Okay, sir. So we are live now.
Sir, yes.
A very good afternoon, everyone. I'm Dr. Raghavendra, so the lecturer in the Faculty of Dentistry, Masa University. I welcome everyone to the webinar series hosted by the Masa University. So the topic for today's presentation is the neuromuscular disorders, the challenges and treatment strategies in prosthodontics. Just to give you a brief idea about today's topic, the success of the conventional complete denture treatment mainly depends on various anatomical, physiological, and psychological factors. The neuromuscular control is an important factor for the positive prognosis of the complete denture processes. Prosthodontic management of patients with neuromuscular disorders is a challenging task. So, to present this topic, we have two speakers with us today. I would like to introduce two speakers for now. So, the first speaker is Professor Dr. Leone Anthony. Professor Dr. Leone Anthony has completed his BDS in 2003 from Government Dental College, Pondicherry, India, with 7 gold medals, including Pondicherry University gold medal. In 2007, he has completed MDS in Prosthodontics and Crown and Bridge from Government Dental College, Pondicherry, India. His continuous academic excellence has awarded him the International Young Scientist in May 2016. He has been awarded with PhD in Prosthodontics and Crown and Bridge in March 2021. Presently, he is working as a professor in prosthodontics at the Faculty of Dentistry, Government Dental College, Chidambaram, which was formerly called as Annamalai University, India. Welcome, Dr. Leone.
Welcome you,
So I
sir.
would like to introduce.
Thank you for the introduction.
Thank you, sir. So I would like to invite the second speaker for today, Associate Professor Dr. Jafar A.M. Usman. He has completed his BDS in the year 1999 from Tamil Nadu Dr. MGR Medical University, India. In 2004, he completed Masters of Dental Surgery in Prosthodontics at Sri Ramachandra Institute of Higher Education and Research, India. In 2008, he was awarded fellowship in oral implantology at Indian Society of Oral Implantology, India. He has more than 20 years of clinical and teaching experience in prosthetic dentistry. He is an associate professor and head of the department in prosthodontic dentistry at the Faculty of Dentistry, Masa University, Malaysia. I would like to welcome Dr. Jafar.
Thank you. Thank you, Dr. Raghav.
So I will just hand over the screen to Dr. Leone and Dr. Jafar. Thank you, sir. The screen is all yours.
Yes, sir. Thank you. Thank you. So after the brief introduction, so we'll go into the topic. Topic is neuromuscular disorders, challenges and treatment strategies in prosthodontics. Why are we mainly focusing this particular topic at the current junction? Is we have a number of aging population both in India, Asian countries, and worldwide. And because of the aging population, we are encountered with a number of systemic diseases and neuromuscular disorders like facial palsy, Alzheimer's disease, Parkinson's disease, myasthenia gravis, so many other diseases. So it becomes a very important or difficult challenge to prosthodontists to deal with neuromuscular disorder patient, especially neuromuscular disorder patient, and in particularly complete denture patients who have other associated diseases, including neuromuscular disorders. Why this problem is there in complete dentures is this neuromuscular disorders causes an imbalance between the various opposing muscles, and they cause muscle weakness, fatigue, and this is a challenging task to prosthodontists, especially when they are fabricating conventional complete dentures. So to before we start into the real topic, we will see a brief overview of various aspects and components of the neuromuscular system. Our body has around 100 billion neurons, and the neuron they innervate muscles. They are the neuromuscular system comprises of motor neurons and sensory neurons and the skeletal fibers. They are muscles. They are both smooth muscles, skeletal muscles. There are different types of muscles. So it a complex of a neural as well as muscular part which coordinates the neuromuscular complex. So in this neuromuscular complex, we have the sensory part, which conveys important sensory outputs via the central nervous system. They go and as an efferent pathway, they go and affect the muscles. They initiate an action by means of a motor pathway, and from the feedback which they obtain from the musculature, they go by a afferent pathway and they go into the central nervous system, and they cause either a decrease in the amount of neuromuscular neural output or increase in the neural output. Thereby they have a coordinated control on the various movements of the musculature. So there are two components in this system. Already you should be knowing is the autonomic nervous system, which controls involuntary actions, and the somatic nervous system, which controls the voluntary action. And they are all coordinated in the central nervous system, cerebellum, cerebrum, pons, and medulla oblongata. They all have a coordinated effect both by the somatic as well as autonomic nervous systems. They are controlled by nucleus in the cerebral nervous system. They are affected by in the neuromuscular junction, that is called as the neuromuscular junction, via various types of receptors and various transmitters. Like already you would have known about acetylcholine transmitters as well as other transmitters which create change in the electrical field, and the receptors they affect these responses. These this junction of this nerve and the muscle is very important. It's a synapse, and many diseases, for example, the myasthenia gravis disease, has auto antibodies initiated against these receptor sites and affect a poor response in the muscular behavior. So we'll be seeing in detail about what are the various features, and we'll be focusing on the various aspects of myasthenia gravis and prosthodontic aspect. So, as I was saying to you, there are centers in the central nervous system which control the mastication as well as your muscles of facial expression. Mainly the hypothalamus, amygdala, prefrontal area, basal nucleus, premotor, supplementary motor area. All these sensors are given to the mastication center, and they initiate a motor nerve impulse which are transmitted to various muscles, namely the facial muscles, masticatory muscles, tongue muscles, and the process of mastication initiates a further sensory output, and in turn it goes as a negative or a positive feedback to the thalamus, and once again it goes to the masticatory centers in the central nervous system. So it's a positive and a negative feedback coordinated attempt by the body, by both the central nervous system and the peripheral nervous system, with the muscles in between. So this is about the these are the things which we have seen about the neuromuscular junction. Now, I think Dr. Jaffer will further enlighten us about the various muscles and various aspects of the muscular systems in the next few slides. Dr. Jaffer.
Yeah. Okay. Thank you. Okay. In a general perspective, we see a large number of neuromuscular disorder which have the manifestations in the extraoral and intraoral maxillofacial region. Extraorally, the muscles of facial expression, and then Intraorally, the muscles of mastication can influence the retention, stability, and support of the complete dentures. So influencing the musculature with the dentures, there are fixing muscles which tend to fix the existing complete denture by creating a muscular pressure on the secondary supporting surfaces. And then there are dislocating muscles which tend to primarily dislodge a denture during a muscular activity. Okay, the fixing muscles and the dislocating muscles, we have the vestibular fixing muscles such as buccinator, orbicularis oris, and then the lingual fixing muscles like lingual longitudinal transverse, vertical genioglossus, which tends to fix the dentures by creating the muscular pressure on the secondary supporting areas. Whereas the dislocating muscles, the vestibular dislocating muscles such as mentalis masseter, then the lingual dislocating muscles like styloglossus, medial pterygoid, palatoglossus, mylohyoid can influence the denture from the dislodgement. This could be seen both in the maxillary as well as the mandibular complete dentures. The involvement of the neural and musculature, here we see three common entities. One is myasthenia gravis, which can be seen as an autoimmune condition, which is primarily due to lack of muscle strength, and then facial paralysis, which could be a complete or a partial, and then from the Parkinson's disease, which could be due to the depletion of dopamine secreting cells. So the treatment strategies when we are going to treat a patient with a neuromuscular disorder with a complete denture has to be sustained. Here, etiology should be known. It could be an unknown or a known etiology, and then we need to focus on relevant investigations which could lead us to a confirmative diagnosis. Always early diagnosis is better to plan the course of the treatment, and then during the effective prosthodontic care, we need to focus about the duration of the treatment and then finally the cost involved in the treatment. Also, to add upon, special precautions has to be followed during the course of the treatment, which could include, say, for example, a prophylactic medications and then duration and then the cost also. Review should be also followed to focus and counsel the patient once the treatment is completed. So the challenges for the dentist is predominantly the abnormalities which is seen in the dentition, the occlusion, as well as the soft tissues. This could be a diversified factor and can be related to one each other. So we need to prepare guidelines for patients who are undergoing a prosthodontic treatment such as complete denture. Before the beginning of the treatment, it is always better to have a medical consultation, especially when the patient says he has not seen his physician for the past 1 year. Also, we need to consult the physician when the patient's status, severity, and the level of control is uncertain. And then the medications and the dosages, which is not told by the patient or not aware or known by the patient, these factors are very, very essential to be consulted much earlier before beginning our dental treatment. The stress reduction, we need to know how to control the stress and the anxiety of the patients. To manage this, we recommend to keep appointments at a shorter intervals and preferably to fix an appointment in the morning session. And then we need to be aware that any prescriptions of medications should involve a minor CNS depressants. So on the course of the treatment, we need to follow the airway maintenance always. A proper ventilation should be always followed. And then if you are using any operative procedures, it is recommended that we follow up with a rubber dam. Infection control should also be looked into. We should start with antibacterial liquid mouthwashes before seeing the oral cavity or treating. Contact with aerosol should always be minimal to avoid further complications with the patient. Yeah, Dr. Leone?
Yes, sir. Thank you. Thank you for your brief outline of the various challenges as well as the muscles. Now, a very important neuromuscular dysfunction disorder we encounter is myasthenia gravis, which advanced age. It normally happens, what they say is more, it has a predilection towards females when compared to males. And the two females above the age of 40, they are more affected because of the myasthenia gravis. And this disorder leads to facial and masticating muscle weakness associated with the dysphagia, that is the difficulty in swallowing, dysarthria, not able to speech properly. There are tremors, there are expression, they have a facial expression which is gravid. That is why it's called as myasthenia gravis. They have a masked appearance, which from which we can identify that this patient is suffering from myasthenia gravis. Along with this, we have a number of tests which can be done to identify whether the patient is suffering from this sort of disorder, especially the myasthenia gravis disorder. One of the beautiful tests is the serum autoantibodies against the acetylcholine receptors, and antibodies against muscle-specific tyronin kinase (MuSK), and antibodies against low-density lipoprotein receptors related to protein 4 (LRP4), and the thymoma-associated myasthenia gravis, which can, due to the thymic hyperplasia, this also can lead to myasthenia gravis. What are the various medical or the pharmacological treatment modalities? Patient has to be on a long-term or lifetime dosage of cholinesterase inhibitors, example pyridostigmine, corticosteroids, immunosuppressive drugs, plasma exchange, as well as in cases of thymic hyperplasia, they have to go for a thymectomy. Okay, so what are the challenges we encounter when the patient has dysarthria? They have muscle incoordination. The patient has to be given dentures with following a neutral zone technique. Neutral zone technique localizes the denture in a location where there is a neutral space. There is opposition. There is no conflict between the lingual tongue muscles as well as the buccal muscle from the outside. So a neutral zone technique is to be followed in this type of patients. And whenever we give the occlusal point of view, try to give a lingualized occlusion with a monoplane teeth on the mandibular. So there will be least interferences in the denture, and because of this least interferences, denture stability is going to be much better. So in those patients who are able to afford, it is better to go for an implant supported complete dentures because of a superior retention and support to the dentures. When you compare implant supported and conventional dentures, definitely implant supported, except for the cost wise, it is having much more better advantages over the conventional dentures. Conventional dentures are economically cheaper, but they are definitely far inferior in relation to retention and stability. So if it is possible in a case of myasthenia gravis patient, go for a implant supported complete dentures. Here we can see a patient who has come for the dental clinic with a myasthenia gravis. Efforts have been done to this patient to convincing the patient to go for implant supported complete denture. But what has happened is the patient is not able to afford for an implant supported complete denture. So what they have done is they have constructed a conventional maxillary denture and a tooth supported tooth supported mandibular over denture. They have used in the process a medium body monophase elastomeric impression material for taking the impression. These materials are quick setting, and they are able to record the fine details in a shorter duration of time. With regard to the neutral zone technique, what they have followed, as against the zinc oxide which is followed in India, they have followed, they have used a viscogel soft tissue liner, uh, which is impregnated onto the triangular occlusal drums which they have fabricated. And this procedure is called as a piezography. And this is an advanced technique which they have followed in this particular situation to record the neutral zone technique. And at the end, they have, you can see the complete denture is fabricated, and they are seeing a good prognosis. Patient is able to adapt the denture much better in spite of the neuromuscular disorder, that is myasthenia gravis. Next, we see neuromuscular disorder, namely cerebral ataxia. This disorder mainly attacks the, it is because of the cerebellum, the part of the brain system, which is called as a brainstem. A part of the brainstem is called as cerebellum, and the main masticatory centers and the coordinator centers are located in the brainstem. And because of this affected cerebellum, the patient develops poor coordination, intentional tremors, dysnergia, dysmetria. That is, the patient is not able to extend particular the hand to a particular distance. He is not able to measure the distance. Dysarthria, patient is not able to speak properly. And associated with these are ataxic gaits, like an alcoholic gait. Patient has these. So a patient with these disorders requires special attention. And as in the case of myasthenia gravis, we require this because of the muscle incoordination. We require certain modifications in our treatment strategies by employing non-anatomic teeth or monoplane teeth. And because of the incoordination, we'll have to record the centriculation in a appropriate manner. How do we do it is by using a Dawson's bimanual manipulation. And by using a Dawson bimanual manipulation, we guide the patient into a centriculation position, which the patient normally is not able to do it. So the patient's head is made to lie between the operator's rib cage and the C-shaped enclosure of the two hands. That is why it's called as a Dawson's bimanual palpation technique. And by this, we guide the patient into a centriculation position. So these things have to be adopted in a cerebral ataxia case. Here is a patient who has been affected by cerebral ataxia for the past 10-15 years. And the patient is on CNS depressants and other neurological agents which support her ataxia. Patient has reported to the clinic, but patient has difficulty in inserting the denture, as well as she has already an existing denture which has multiple fractures in the and repair works done. So to support the patient, we have done this complete denture with a monoplane occlusion. We have done a Dawson's bimanual palpation technique for recording the centriculation, as well as we have supported the patient with a stronger denture by means of providing a mesh, metal mesh supporting the complete denture, especially maxillary complete denture. So these things are to be given to the patient with ataxia. Then we come into a next neuromuscular disorder, namely the facial paralysis, which is only one of the commonest paralysis is associated with hemiplegia, paraplegia, and all these patients with cerebral cerebral stroke. Patients' facial muscles are drastically affected. It can be a full facial paralysis, or it could be a hemiplegia associated with one side of the face. So what happens? The patient is not able to blow through them. That is one of the important tests which we have to do, is asking the patient to blow through the mouth, whether the patient is able to blow through the mouth. No, most of the patients will not be able to do. That is a confirmatory finding that facial paralysis happened to the patient. On one side of the patient face is stiff, and the other side, the mandible deviation or the lip activity will be more. So salivary drooling, all these associated features of facial paralysis we can see. And the drooping of the eyelids, one side of the face is without expression, the other side is with expression. All these are some of the characteristics features of this facial paralysis. Here we can see a patient suffering from facial palsy, a complete facial palsy, and the lips are not totally supported. So what they have done is they have tried a neutral zone technique. Along with that neutral zone technique, they have incorporated something called as the cheek plumpers, which are attached with the conventional complete denture by means of magnets to support the face, because the patient is having a expressionless face. This is a case of this is another case with patient is suffering from a right side facial paralysis. So in this particular situation, what they have done is the patient has been subjected to a neutral zone technique for recording the jaw relation, and a silicone index is made to record the neutral zone technique, and the usage of non-anatomic teeth has been done, and the neutral zone is recorded, and they are by means of two. That is, first the jaw relation is done by means of conventional occlusal drum. Then a second jaw relation has been done with a compound occlusal drum, and the impressions are still made by means of your zinc oxide renal impression. So by this way, the patient's inadvertent musculature behavior is compensated by the neutral zone technique. Then we come into the last neuromuscular disorder for today is Parkinson's disease. This patient is typically has a behavior called as a pill rolling tremor. Patients like to roll the pill rolling tremor. One of the characteristic feature of this particular patient is every time the patient reports to the dental office, the patient will look at you and say, "Who are you?" Every time the dentist has to identify and tell that I am your doctor, dental doctor, and I am here to construct your denture. So that is the problem with this particular patient, and a total care for the patient has to be given in this particular disease, along with other problems like neuromuscular incoordination, muscle rigidity, postural instability, gait disturbance. All these are associated features of this Parkinson's disease. So how do you manage this disease? The literature says we can manage it by means of lingualized occlusion. We can go for additional support by means of implant supported dentures. If few remaining teeth are there, the dentist has to make a careful evaluation of the teeth, whether the teeth can be saved. The patient has to be encouraged not to go for extraction, or the dentist should make every effort not to extract the remaining natural tooth. And ORS, that is a overdenture, can be fabricated, either a conventional overdenture or a magnetic supported overdenture, or if the patient is able to afford, they can go for implant supported overdenture. And of course, neutral zone techniques have to be followed to record the musculature. There is another patient with Parkinson's disease. You can see the neutral zone technique has been followed to record the muscular influence. A block has been kept in the mandibular to record to have a vertical dimension stop. Compound rims have been fabricated, and by means of silicone index, they record the neutral zone, and a teeth setting has been done, and the patient is able to chew properly as a stability and retention features in spite of it, or Parkinson's disease. The patient is also able to take or seriously taking disease pharmacologic agents like Syndopa. One of the problems with these patients with Parkinson's disease and other diseases is patients will have poor salivary content. Either it could be hypersalivation or it could be hyposalivation. So if the patient is having hypersalivation, what you should be willing to do is you should have a high volume suction ready for recording your impressions as well as doing your jaw relation procedures. If it is hyposalivation, then you should make efforts to include certain things like artificial saliva or denture adhesives can be incorporated. It's a side effect of some pharmacological agents, medications what they take. So the dentist has to appropriately take measures to incorporate into the treatment plan. Fine. So now we have seen the most challenging thing is the complete denture. But as a finishing note, I would like to add that in case of we are going for a removable processes for some patients with these type of neuromuscular disorders, then what we should do? We should try to preserve all the teeth as much as possible. Whenever is possible, don't extract the teeth. If at all, if few teeth are there, make sure that the teeth are remaining good periodontally with caries free by asking the patient to regularly come for dental hygiene measures. Oral prophylaxis has to be done. Mouthwashes has to be given to the patient. And suppose if you're going for an RPD for replacing a missing tooth or few missing tooth, then preferably don't encourage the patient go for a clasped denture or metal clasped denture, because of the fact that choking can happen and because it could be life threatening. So as and when possible, go for flexible dentures without clasp free dentures, which are acrylic, soft acrylic. If an FPD patient, FPD you are planning to do, use high volume suction while doing a preparation, as well as go for FPDs which are margins which are supragingival or equigingival, so that to enhance cleansability post insertion, post cementation, and use a dual Q resin cement in the FPD because of the limited or nil micro leakage happening in the dual Q resin cement which is existing in the market. So these things, precautions have to be remembered, especially when you're dealing with removable or fixed partial denture situations. Okay, so we are coming to the end of the webinar. So what are the key points we have to remember is the patient's existing denture, dentition has to be preserved as much as possible. Whenever you are having the situation of neuromuscular disorder, try to preserve the dentition. Your extraction and replacement should be the last. If suppose the dentition is there, you should maintain the dentition by advising the patient frequent oral hygiene measures, both in office as well as at home. The patient is not able to brush, then usage of mechanical toothbrush, automatic toothbrush has to be advised. Before even proceeding with the prosthodontic treatment plan, the medication history and the drug history and the medical history of the patient has to be thoroughly examined before we even start with your prosthodontic treatment. When we plan for a prosthodontic treatment, make sure that it is done in the morning with only limited time, that is 45 minutes time duration only has to be given to make the patient comfortable. And the limited chair time has to be given. Usage of fast setting impression materials have to be done. The centriclation procedures also have to be fast enough. All these important tips have to be kept whenever we are dealing with a patient with a neuromuscular disorder. And if economics of the patient demands or the patient is able to afford, then go for a implant supported overdenture to increase the stability in the support. Okay, to summarize, geriatric health is a very important aspect nowadays because of the aging population, both in the Asian continent, India, and with age, we are encountering a lot of neuromuscular disorders. So musculature plays an important role in prosthodontics. So prosthodontists have to have a clear-cut idea of what we are dealing with in neuromuscular disorders, how to cope up with the neuromuscular disorder, what is beneficial for the neuromuscular disorder patient prosthodontically, what will be the success if you prescribe a particular procedure, and whether the implant procedure is going to be a success or it is going to be a failure, whether a conventional prosthodontic procedure is going to be a success or a failure. All this has to be ascertained and explained to the patient after duly consulting with the physician or taking an opinion for the physician. A teamwork has to be done, and a meticulous review also of the patient have to be done to ensure the success of complete denture or a removable denture processes success in dentistry. I think should be fine. I think we are coming to the end of this slide, and thank you. These are my references and a few references I've taken. I think I leave it to the audience for any queries, if anybody is having any queries.
Thank you so much, Dr. Leone and Dr. Jaffer, for providing us an insight into the neuromuscular disorders and the challenges and the treatment strategies which are involved in the complete denture. I don't see any questions here. Thank you so much, both the doctors, for the informative session. So, with this, I would like to end the session.
Okay.
Stay tuned into the Masa University Facebook page for the upcoming webinars from the Faculty of Dentistry. Thank you so much for everyone for joining this webinar. See you soon with one more interesting topic. Thank you. Thank you, Dr. Leone. Thank you, Jaffer. Take care. Bye-bye.
Thank you, sir. Thank
Thank
you,
you.
Dr. Jaffer, for this
Thank you.
session. See you then. See you later. Okay.
Thank
Take
you.
care. Take
Bye-bye.
care.
Thank
Yes,
you.
sir.
Thank you.
Bye-bye.